Today we'll be talking about a very important topic that is very crucial that everybody should have knowledge of. We've discovered that a lot of persons have lost their lives due to events that could have been averted 100%. And most times, a lot of persons don't know what to do in events where somebody suddenly slumped around them or somebody was rescued from drowning. They are kind of confused, they don't know what to do. And this singular action or this singular thing that we'll be talking about can save a lot of lives if done promptly. I'm talking about the cardiopulmonary resuscitation, that is CPR. The next question is, when do you do CPR? You do CPR when somebody suddenly stops breathing or the heart suddenly stops working, or when the person is electrocuted, the person is rescued from drowning, the person suddenly slumps, or the person is suffocating, or even a victim of drug overdose. Let's talk about the importance of CPR. It's been discovered that the first few minutes are very crucial in giving CPR because this initial period when the heart suddenly stops working without effective cardiopulmonary resuscitation in order to manually pump blood to the brain and other parts of the body, it could result to irreversible damage within few minutes. Hence, it's very, very important that if you discover that someone suddenly slumps, somebody is rescued from drowning, somebody is electrocuted, somebody is suffocated, the first thing you have to do is to commence CPR immediately. Let me show you a video on how to do CPR. CPR stands for cardiopulmonary resuscitation, and to do CPR is a very simple technique. The only thing you need to remember is the acronym doctors ABC. D stands for danger. First of all, you look around you and make sure the place is safe for you and for others. R stands for response. Go close to the patient and check for any response. You can shake the head and ask the person, are you okay? In absence of any response, S stands for shout for help. Make sure you call for help. You can call an ambulance and call people around to come and help. Then the next is the ABC of CPR. Then ABC. A stands for airway. Go close to the person, then tilt the head a little bit backwards. The B stands for breathing. And in breathing, you have to look, listen, and feel. Look at the chest to see if the person is making any movement, breathing movements. Then go close with your ear and check if you can hear any respiratory noise. In the absence of any breathing movement, you can also check to see if you can feel any pulse. If there is none, then you now commence the C part of it, which is circulation. It's very simple. With your two hands, lock them together.
So you place your hands at the chest, center of the chest, and make sure you compress hard and fast. By hard, I mean that you compress at least 5 cm into the chest wall. Then the compression should be 2 compressions in a second. So like this. As you can see, I'm compressing hard and it's also fast. Then make sure that the elbow is straight, the hand is straight and it's not bent. So you compress at least 30 compressions. After the compressions, in some cases, you can give 3 mouth-to-mouth breathing. And make sure you keep compressing until either the patient responds spontaneous breathing or when a trained medical personnel comes around or the ambulance is around. So as you can see, this technique can save a lot of life. And don't forget the doctor's ABC. The D part of it stands for danger, the R for response, S you shout for help, then the ABC, A the airway, B breathing, and C circulation. So it's very, very important. Whenever you see somebody collapse, somebody suddenly stop breathing, make sure you do this as it can save a lot of life. Please do not to share this to your friends, to your colleagues, to your partners, siblings, everybody around you. as it can save somebody's life. And who knows whose life is going to be saved. Thank you very much.